Thank you, Dr. Bhuvaneswari. Incidentally, coffee so the male mic works. Incidentally, coffee is supposed to be complementary to aconite. According to drug relationships, aconite, one of the complementaries is coffee. So, that is just one bit of information. This is support pesala. Now that all the panelists have given their opinions, I would like members from the learned audience to give their own views, experiences, or any points, adding, subtracting, deleting, opposing any of our views here. You are most welcome to open up and say a few points before we come to a kind of conclusion about this whole discussion. But I must say that the path has been opened for every one of us to think more before we blindly say, I don't believe in stopping coffee, or just saying that I am a staunch homeopath, I will not allow any of my patients to take coffee. Life is not in black and white. There are lots of shades of grey in between, and it is these grey areas that have to be brightened. Come on, brighten these grey areas, please.
About my experience, if our drug is in a correct similarium, definitely coffee will not antidote anything.
Once again, it is in the our medicines are in the higher dilution potency, and in almost for selecting the yellow potency, we are taking double the care or triple the care to select the simillimum, because we are going to give in a daily manner, or once or twice a day. So it will not antidote the any other substance, not only the coffee. We are talking about coffee only, because in Hahnemann's time, coffee was considered as a universal beverage. But nowadays, almost all the spicy food, pastry items, fast food items, we have to restrict means we have to restrict our day-to-day daily food substances. Okay, so it is highly impossible to restrict the coffee, but we can advise them to reduce. And most of the coffee addict fellows, usually it is very tough to reduce, ask them to reduce, because they are used to that. It is like de-addiction only. So we have to give, or we can take that symptom as a to make a similarium. That we can do, because they are unable to reduce the coffee. That we can do. In my practice, I am not advising the patient to stop the coffee. Thank you.
Coffee, when the patient given decaffeinated coffee, the cholesterol level rises.
In which?
In decaffeinated coffee.
Okay.
So it's up to the physician and the type of the patient. Either coffee can be administered or decaffeinated totally can be avoided. But this is under research.
You are thorough and you know that it is antidoted by coffee. In many cases I fail in this aspect. I have always been frank enough with you, my students also, that in the drug relationship I have taken an escape route that Nash says don't bother about drug relationships, whatever is the indicated remedy, next we'll do whatever action it is supposed to do, complement, antidote or whatever, follow the next simillimum or whatever you want to call it. But regarding your specific question, if
antidoted by coffee or not, during that time actually when Hahnemann documented or postulated that coffee miasm, like coffee theory, he believed that coffee was the one of the chronic miasm. He postulated like that only previously before discovering the Sora theory. Okay, so that time what he thought means coffee suppresses all the things. Then after that, around 1817, around that, he postulated that Sora theory after just before the chronic diseases release. Okay, so that time Sora is considered as a which miasm. It brings out what are all the suppressed things. Okay, so what he believed means Sora opposite to coffee. Okay, so he himself confessed in his lesser writings and that coffee, I gave overemphasis on coffee. It suppresses all the thing, or it produces all the thing. Now I am confessing that Sora is the almost 7/8 of all the chronic diseases. So what he believed means, okay, now Sora is the doing the favorable effect. Soric diathesis, we have to bring out all the suppressed itch miasm or whatever discharges or excretions. He believed that coffee suppresses all the effects. Okay, so what he mentioned means sorinum is antidoted by soric miasm or soric patients, okay, who needed sorinum, they are antidoted by coffee. That is the thing. And in some instances, some people they experienced sorinum is not antidoted by coffee also. Okay, in that situation only he told like, so it is opposite. He believed like that. Okay, before inventing discovering the soric miasm, and after that he was double-minded, and he himself confessed that I gave overemphasis in soric miasm. We can restrict because what we are thinking like cure, directions are cure. Okay, it should all the suppressed things should come out. This coffee is doing the suppressing effect, so that in soric miasm or soric patients or sorinum patient we can avoid the coffee. Otherwise, it is not needed.
Let me kind of wind up and give a shape to it. Coffee